before, maybe even less than a couple of minutes before I go on with this. And I'd like to get at least 2 or 3 people on here to have a little bit of a discussion. Can you hear me? Can you hear me? Bueller. All right, so topic for today is going to be burnout and moral distress. It's a little bit more of what I spoke of in the latest blog post. But I'm seeing this over and over again. What's going on, Scott? I'm seeing this over and over again on Facebook, and for the life of me, I'm still struggling to wrap my brain around it. It's I had this conversation with Nick Helton, which again I'll say it again. If you're on Instagram, go follow him. Instagram's not my platform of choice, but yeah, go follow him on Instagram. So I'm struggling to understand burnout because after 11 years, I just haven't felt it. It's like I'm sure it exists because people are talking about it. And like I talked with Nick over the weekend, I'm not sure if it's getting worse as time goes on or if it's just less taboo to talk about it. And that's why you're seeing more frequent posts on burnout on Facebook, which is my platform of choice. And I'm still at a loss, and so I decided to delve deeper into this burnout issue, and some of the stuff that I'm finding, it's interesting. So the very first quote in one of the articles that I read was, information about moral distress and its consequences is often inadequate in healthcare provider education. Now, like, I went through PT school like everybody else, right? And I'll just come right out and say it. Some of the courses may not have been time consuming. It's probably the best way to say it. I blew it off. Okay. Now, I'm not quite sure if I just didn't invest that much time into the course in which we talked about moral distress, or if we just really didn't talk about moral distress. I think everybody has that ethical button. And when it gets pushed, it's pushed. You're like, you're getting pushed a little bit over the edge on this one. And I've been there, and trust me, I understand. Because my ethical button has been pushed before in the past, and, I walked out on a job over lunch. What's going on, Tony? I saw your Facebook Live today. I loved it. Anytime you talk about the patient experience, it's great. And so when my ethical button was pushed, I walked out over lunch. I keep saying it more and more, and it sounds so crass, and it might just be the way that I grew up. But you're either going to stand up for something that you believe in, or you're going to bend over. And I don't bend over too frequently. And when I feel like I'm pushed past where that smell test, or the mom test. For me, it's the dad test. If my dad wouldn't be proud of what I am doing, I walk away, and I walk away no regrets, right? And so at lunch, I walked away, and it's unfortunate because students coming out now, I don't know if it's that, they expect something different when they graduated from PT school, but the topics that they're walking into, they're not addressed right now. When you're talking about productivity and how much you're billing per patient and this comprehensive care, that's not talked about. The whole right patient, right therapy, right time, man, I would love it. If every student coming out of school was able to practice in that fashion when they walked into an outpatient clinic, that would be great, right? Life would be awesome. But all of us that have been there, done that, and been around the block a few times know that that's not how it always works. We assume all healthcare providers have the same morals. At least some morals, right? I'll take some morals, so at least they know when their button's been pushed, and they can make that decision as to whether or not they want to walk away. And so I really think that we need a stronger background in ethics in PT undergrad. But it's one of those things, St. Augustine, is it learned, or, is it something innate? Are you innately born that way with this ethical value, or are you learning it over time? I don't have the answer. And honestly, I'm not quite sure if you could take somebody who's just unscrupulous and just educate them in PT school and they're going to be saints. I don't think that happens either. But we do need to spend more time in PT school studying ethics and understanding what we're walking into when we walk into this field, such as productivity and being asked to do things that we don't necessarily feel are right. I want to talk a little bit about moral distress here. And this article goes on to say that, moral distress is essentially when you have this internal knowledge of what you should do, but you have external constraints blocking you from doing what you should do. And some of the things that we see are patients receiving non-beneficial treatment. Sorry if I'm looking off here. I got all this stuff written down. Patients receiving non-beneficial treatment. I question that right off the bat, because it's like, if the patient is receiving non-beneficial treatment, is it because the therapist doesn't know any better? Because the therapist knows better, but is trying to appease a higher authority, not God, but a higher authority, such as a supervisor or a manager, a director. Why are we giving non-beneficial treatments to begin with? So I'm struggling wrapping my head around this, because it's like, I know how I've practiced for 11 years, and it hasn't really led me to a position to where I would ever feel burnt out, or I would ever question. I mean, I may not have been as good 11 years ago as I am today, but at no point in time do I question what I did. It was just I lacked the knowledge at the time. And so to see therapists that are out there giving treatment that they know is non-beneficial, that to me, that's an issue. That's pushing my button. To see patients suffering, I think we can, for the most part, all agree on that, unless you're unscrupulous. Care is not consistent with the patient preferences. What's going on, Yola? Care is not consistent with the patient preferences. Give and take, right? Because that whole patient preferences portion is a part of that three-legged stool, or the funnel, whichever vision of evidence-based practice you're following. We do have to take in some of that patient preferences in order to make sure that we're achieving those quality outcomes. Lack of administrative support, I've seen that over and over again. I'm not going to put down any place that I've worked, right, because it provided me a paycheck and allowed me to support my family. But one of the one of the key principles in one of the locations that I was at was, well, just do your best. Just do your best. There was no, what's going on, Chuck? Thanks for watching, man. There was absolutely no decision making to be had. It was just do what you feel is right. And if we think you're not right, we're going to come down on you anyways. So yeah, that lack of administrative support, nobody wants to make a decision. Perceived powerlessness. I think this is huge in our profession, right? Because people don't want to take action because either they don't feel appreciated, they don't feel like their actions or their questions, or I guess life is good, Chuck. Their actions or anything that they have to offer is going to make a difference. And so if they perceive that powerless, then they start playing the victim role. There's actually that victim cycle that you can see in some of the research regarding... Give me 1 second. Sorry, guys. Somebody wanted to get up. So that powerlessness, that's an issue, and I've actually seen that in my career and where I've been at with the companies I've worked for, to where you don't even want to make a change because you realize that nothing that you do is going to be supported. And so if that's the case, then you just go along status quo for years and years and years on end. And to me, that's an issue. I mean, I got into this. I want to, rise and keep getting better year to year. So, and then competing obligations. You have an obligation to your company. You have an obligation to your patient. You have an obligation to the payer too. So you have an obligation to the insurance company, and you have an obligation to your own moral clauses. And so you have all of these obligations, and determining which obligation is going to weigh more on your decision, I think that's going to lead to whether or not you feel burnt out or not in this profession. So, in my blog post, I go on to talk a lot about money and how a lot of the decisions that are made in healthcare essentially wrap around that whole money equation, increase the money in, decrease the money out. And so, you're looking at overhead. I get it. Keep your doors open. But how many, please no, how many doors do you have to keep open? Are you keeping your doors open at the business? Are you keeping your doors open at home? Are you keeping, the owner's doors open? How many doors do you have to keep open? All right, I'll give you one. How many doors do you have to keep open in order to have a successful company? And so next what we're seeing is that, poor work environments are associated with higher frequency of healthcare-associated infections. Persistent moral distress can progress to burnout. What's going on, Tommy? Can progress to burnout, which is the topic of choice, right? This is really what we're talking about is burnout. With increased episodes of hospital-acquired infections. And I think that the biggest detail is that if you are experiencing burnout, we know that patient care actually worsens. If patient care worsens, you may not pay attention to the details. Like small issues, but you may not scrub in, scrub out if you're going into a room. And if you're not washing your hands, by the way, if you ever find yourself in an environment where you're seeking healthcare, whether it's through physical therapy and outpatient, you're in a hospital, do not hesitate to ask your provider to wash their hands. Okay, that's extremely important to prevent these hospital-acquired infections. So do not hesitate to say, hey, did you wash your hands? And you know what? If I washed my hands and the patient's asking me, I'm going to wash my hands again, right? Because the last thing I want to do is get into an argument over hand washing when it's something that's going to take me just a couple of minutes to get it done so we can move on. So, yeah, we know that burnout can lead to hospital-acquired infections. Okay? And so if you're going to therapy, if you're going to the hospital, look around you. The person that's caring for you, do they look happy, right? Are they energized? Do they look like they're fulfilled? If not, man, you might want to turn around and walk out because your risk of acquiring some sort of infection actually is going to go up when people are more burnt out. And the being burnt out is going to lead to symptoms exactly opposite to that. You're exhausted, emotionally, physically exhausted. You're sad. You're not energized when you walk into work. And so if you're in a place where you're seeing that type of environment, walk away. And hey, you can walk into my place. Just saying. Next, when we look at burnout, there were 3 things that we saw in this research study that may lead to it. And one of them is the work environment, right? Are you with people that are pushing you? Are you in a place where they don't really care about your values? You have to watch the work environment. The second one is a lack of strong ethical resources. When you don't have somebody that you can confide in or somebody that can help you out when you're in a bind, in terms of making a decision, that can actually lead to burnout. Okay, and then the last one is heavy workloads. So the more patients per hour that you're seeing, the more likely you are to have this moral distress. And it makes sense, if you can't treat patients the way that you feel patients should be treated because you have 3 people in the clinic at once, it's kind of hard to provide the care that you think those patients deserve. So if anybody out there has any questions on burnout, moral distress, what have you, please comment below. I'd love to, dive into discussions on this stuff. The final part of this research study, they developed a protocol, actually, and this is all based off of nurses. So for those of you that don't know, the research for physical therapy and burnout and physical therapy and moral distress, almost non-existent. There is some research, 30 to 40 years old, but almost non-existent. And so this is what they created. They created what's called the support model. Support, SUPPORT, standing for seek it out. So if you see it, you have to address it, understand it, try to figure out why people are experiencing this moral distress, why burnout is occurring. Pay attention to the workplace climate. You know, are your coworkers coming in dragging? Are they lacking energy? Are they sad? Do they feel like they've lost hope? Promote receptive environment engagement. Just get out there and talk to people. I mean, talk to your coworkers, talk to the people that are coming into the clinic. Create open opportunities for dialogue. So again, this has to be addressed. If you have an ethical issue, we can't treat it like taboo. You know, there's a lot of people on Facebook that hesitate about asking these questions regarding how many patients per hour should I be treating? How many units per hour should I be billing? Is it right for me to be delegating a patient to a tech? The answer to that is no. So they're paying for physical therapy. They should not be paying for a tech. But these questions, you know, they need to be asked because nobody wants to bring up the topic. So, you know, here we go. Reflect, evaluate, and revise. When you see a problem, you know, just like if you have an incident report, when you see a problem, it needs to be addressed, and you need to think about why it became a problem in the first place, and whether or not you have to actually update any of your protocols or guidelines in whatever environment that you're in, and that's where that transform the environment comes into play. You have to make changes when you see something's not working. So, everybody, thanks for watching. You can find me at movementthinker.org. I'm going to start giving myself plugs, and you know, keep your eyes out. I've got a course coming out at some point in the near future. I'll be teaching the IPTA. I'll be teaching an ethics course for the Illinois Physical Therapy Association in May, talking about burnout. And so this is my chance to just give this information away for free. And what I want is open dialogue, right? That to me, that's the most important part of of what's happening in our profession right now is we need the open dialogue. And so what I'm really hoping is that if I give away enough of this information, that when I start presenting this information during the course, people would have already heard it once, they may have heard it twice, and so then at that point, they're coming more with questions and scenarios, more so than just coming to hear me just, you know, pontificate about what's going on in our profession. So thanks for watching. Have a good night.